Hi, my name is Dr. Lori Anderson. I'm a pediatrician here at Amistad Community Health Center. We take care of lots of kids here, mostly uninsured and underinsured, but we also take care of anybody that wants to come to the Community Health Center. Today, I'd like to talk to you about some issues in school health and also with immunizations.
What is the history of immunizations?
Immunizations were really first developed by the Chinese, but they weren't labeled as immunizations. That was somewhere around 1100. But our first known immunizations here in the Western Hemisphere were developed by Edward Jenner in 1798, and when he learned that if he inoculated milkmaids with cowpox, that they did not ever get smallpox. And so from studying that, he developed the first vaccinations against smallpox.
What does immunization refer to, and/or what is a vaccination?
So immunization refers to the act of building up your immune system to be able to fight off a viral infection when you are exposed to that virus. And vaccination refers to the process of introducing the immunization to the person. We call it vaccination.
Can you please list a few vaccine-preventable diseases?
I would say thanks to the medical community and those that have gone before us, we have many vaccine-preventable diseases for which children do not now suffer from. This has been a huge advance in medicine and something that has really been one of the greatest advances of medicine. For instance, we don't have very many cases of measles. You may have read that we did have some outbreak last year, and that was traced to the fact that those children had not been immunized. We also can vaccinate against tetanus, against polio, against chickenpox, against pneumococcal pneumonia, and Haemophilus influenza, meningitis, and ear infections. We can vaccinate against rotavirus, which used to be the most common cause of diarrheal illnesses in infants. We can vaccinate against meningococcus, which causes a terrible brain infection and serious consequences afterward. We vaccinate against diphtheria. We don't see that anymore because of our vaccinations. We also vaccinate against human papillomavirus. That is the first vaccine that we know we can prevent certain cancers with. It is a huge advancement in medicine. In addition to those that I just mentioned, they also can immunize against hepatitis A and hepatitis B, and we're hoping soon to have a vaccine against hepatitis C.
Why should parents vaccinate their children?
There are 5 great reasons that actually have been delineated as to why you want to vaccinate your child. And I think the most important is that vaccines can save your child's life. We don't see many diseases now that 30 years ago when I first started training as a physician, we saw diseases that caused meningitis, that caused death, that caused sepsis, and I don't see those anymore. The reason I don't see them anymore is because we have vaccines that prevent them. We don't see cases of measles because of vaccination. So I think the most important message to take is that vaccines can save your child's life, and it's the best way we can protect your child. So that's the number one reason. The other reason, of course, is vaccines are very safe and effective. I don't think there's anything in medicine that we have studied more closely than vaccinations. Every vaccination that we give is plotted by their lot number, they're recorded, and they are available to be researched should anybody have any kind of reaction that they thought was related to the vaccination. Fortunately, through studying this, they have shown through scientific method, multiple occasions, that vaccines are very safe and they are effective. The third reason is that vaccines actually protect other people that you care about. Right now, we cannot vaccinate under age 6 months for pertussis, yet pertussis kills babies. That's the whooping cough. So by getting your own vaccine and your child's vaccine for pertussis, you're protecting those who cannot be vaccinated because they're too young or because of their immune system not being developed enough to take the vaccine or to be effective to that person whose immune system has not been developed. So for those folks, you're protecting them by vaccinating yourselves and your family. And that's the only method that we have to protect them. Another thing that we're all concerned about, of course, is time and money. And actually, vaccination is the fastest and least expensive way to protect you and your family from certain illnesses. So we think that we truly believe that if you vaccinate, you can avoid extra time and money spent at the doctor's office for those particular kinds of diseases. The last one is that immunizations do protect future generations. We don't see polio in this country now because we vaccinated, but if you look back just 50 to 60 years, people suffered from polio. By eliminating polio from this country, we now have protected the generations that will come after us. That's one disease that they aren't going to be afflicted by. So when we vaccinate now, we can protect our future generations.
Are there any concerns with having my child vaccinated or not having my child vaccinated?
Vaccines are safe for almost every single person. However, there are rare occasions where a person's immune system is not developed and the vaccine will either not be effective or may cause them some harm because of the way that their immune system is built. For those persons, they don't get vaccinated, but that is something that a doctor will be able to tell you, and those people are very rare. We vaccinate now for flu with people who have egg allergy because we've proven that they can tolerate the vaccine safely. So there are very few exceptions to the ability to vaccinate.
What vaccinations are important to my child as an infant, teen, or adolescent?
Well, let me just go by each stage. In infancy, there's some vaccines that are, of course, very important that your physician will remind you of, and those are the 2-month, 4-month, 6-month, and 1-year vaccines. There are multiple vaccines that are given. They cover everything from tetanus, diphtheria, polio, hepatitis A and B. They also cover Haemophilus influenza bacterial infections. They also cover pneumococcal infections. At 1 year, they get a measles vaccination and a chickenpox vaccination. So those are the major ones in infancy and early childhood. Right before they go to school at age 4 years, after their 4th birthday, they receive a booster of their diphtheria, pertussis, and tetanus, along with another measles and varicella vaccination. When we get to the teenage years, they continue to need some vaccines. They get a booster called a Tdap that boosts their pertussis immunity and also their tetanus immunity. They get a meningococcal vaccination to protect them against meningococcal meningitis. And then we also start the human papilloma vaccination series at this age. We like to start that series between the ages of 11 and 12. Human papillomavirus vaccination is another vaccine that, although it's not required by the schools, is endorsed by the Academy of Pediatrics, the Academy of Family Physicians, the Center for Disease Control, all believe that this vaccine is very important to adolescent health. This is a vaccination that can prevent certain types of cancers, and it's the only vaccine we have that we know can prevent certain types of cancers. This vaccine has been out for more than 10 years, and the data on it has been studied very, very carefully. And from that data, we know that it is safe and also that it is effective. So for those reasons, we advocate that every teenager get vaccinated with HPV. That's a series of 3 doses. When they do turn 16 and they're 5 years past their first meningococcal vaccination, they get a booster of meningococcal vaccination. And then the other thing that we truly believe in is your flu vaccinations. Flu vaccines can not only keep your child in school during flu season because they're protected, it can prevent spread to the elderly who do not sometimes form a good immune response to a vaccination. They can cut down on illnesses spread through your whole household by getting your kids vaccinated for the flu, because actually they're the most likely to bring it home from school and infect the rest of the family. So flu vaccines have become mandated in certain states for certain age groups. In New Jersey, they started with the 4-year-old pre-K level because they felt that that was the most effective way to get started to prevent the spread. But it is recommended for every child now, every year, they need to get a flu vaccine.
If I do not have insurance, can my child still be vaccinated?
The great news about that question is that absolutely yes, your child can still be vaccinated. There's 2 reasons why that is possible. Number one is with Obamacare, preventive health services are supposed to be covered 100%. And then we have found that to be true. So if you have an insurance plan, you are covered for preventive health, which includes the vaccines. So all of the vaccines should be covered. If you do not have health insurance or are between health insurances or can't afford health insurance or for any other reason have not been able to obtain insurance, then you can still be vaccinated because there is a program through the Texas Vaccines for Children that supplies vaccines free of cost. Public health people so believe that vaccines are important to every child's health that they have made them free for those who cannot afford them. So you wouldn't be charged for the cost of the vaccine. You can be charged between $10 and up to $25, although most places would charge you less to get your child vaccinated, but the vaccine itself would be free. That can be done at the health department, and we also do this at Amistad, but any of your pediatricians can also put you under the Texas Vaccines for Children program and can administer vaccines from that particular allotment.
What vital role do school health professionals, school nurses, and school administrators have in protecting communities against vaccine-preventable diseases?
So this is a particular passion of mine, actually, is the schools and their role in health for children and their families. And the reason is because not every child has a doctor, but every child gets to go to school. Thank God for that, right? But having said that, sometimes the only avenue of education that some of these families will have is coming through the schools. What I'm trying to say is that there are some families out there that have no idea, for instance, that we have a cancer-preventing vaccine. They don't even know it exists because they haven't been to the doctor or a healthcare professional for many, many years. And when they may have heard about it, it might have been 6, 7, 8 years ago when we didn't have the same amount of information that we have now. So the school can be so critical in updating families on what vaccines are available, what vaccines are recommended from the Academy of Pediatrics or the Centers for Disease Control, and they can really help with public health by getting this information to every child that attends school. In closing, what I would like to recommend is that if you have any questions about vaccinations, go to the reputable sites on the internet. The problem sometimes with the internet is you can pull up a subject and somebody could put a blog out there and it has nothing to do with the scientific evidence. It can be anecdotal, it can be an opinion, it can be a time-related thing, but not necessarily scientifically proven. So for that reason, I strongly recommend if you're going to research vaccines, go to the CDC website. They have great information about each vaccination. Go to the Academy of Pediatrics or the Academy of Family Physicians. This concludes the School Health and Immunizations videotape that we made to try to bring more information to you. If you have any other questions, you're also welcome to call me at Amistad Community Health Center